Next presentation is by Sam Bates. She's an assistant clinical nurse manager at WAC's Southwest Immunisation Program and the assistant regional lead in SBIP. Sam has been a registered nurse for over 20 years. She started with WAC Southwest in 2012, joining the Bunbury team and also as a regional staff health nurse. In 2020, she was involved with COVID public health contact tracing team, and 2021 seconded as co-lead for the Southwest COVID vaccination program. Sorry.
Hi. So Vaccinate WA was introduced as the online consent platform in the school-based immunisation program across the state late last year and early this year. Like other regions in WA, the Southwest experienced many challenges in the transition from a paper-based system to electronic platform. Despite these challenges, the school-based team began to appreciate the benefits of Vaccinate WA and using electronic consent and have learnt many lessons along the way. Sharing this story and reflecting on 2023 is an important step in strengthening the school-based program, and this is a Southwest story. So pre-COVID, the Southwest school-based program ran smoothly. Rates were good, parents didn't question the need for adolescent vaccinations, and all was well in our 3 but solid teams that covered over 30 schools across the Southwest's 4 districts. Like most regions, Southwest struggled over the COVID years with the declining numbers, vaccine fatigue and hesitancy, and the changed ways in which the schools communicated with the students and parents. The implementation of Vaccinate WA into the school program late last year, and with the late changes to the program in early term 1, seemed to cause a lot of stress within the school team programs. The start of Year 7 school-based program in 2023 was messy. I was co-running the COVID program with Janine, and having used Vaccinate WA through COVID, we tried our best to support the school-based teams. While I was enjoying a much-needed holiday in New Zealand in term 1, the Southwest program, and especially Bunbury, crashed and burned. I returned blissfully unaware, given a whole 24 hours notice before school base was thrown heavily into my lap. The Bunbury team had all resigned and the whole program had been put on hold mid-term. Nancy Starve again. So what did we do? We took on board the issues that the vaccinators were having. Lots could be really easily troubleshooted. For example, the teams were having really slow connection programs. But somewhere along the way, someone had told them they had to use virtual desktop to access Vaccinate WA. So getting rid of unnecessary steps like this really sped up the process. Katie and I held a school-based specific update day for all Southwest teams, and an EOI went out for vaccinators who were interested in joining the Bunbury team. And during the update, we covered issues vaccinators were having. We troubleshooted Vaccinate WA. Things like where to find consent, what bits to be looking at, and the places that didn't really matter within the system for the vaccinators to use it. With a team that was open to moving forward with the program and the use of Vaccinate WA, we recommenced in term 2. Now, I think I'm one of Vaccinate WA's biggest champions. I love it. I see it as a fantastic way of moving forward with vaccination records in Western Australia. One thing I learnt with the COVID program is that we have to be adaptable to change. And boy, did the COVID program change, sometimes daily and with little notice. Had we not been adaptable to this change, I think we would have been rocking in a corner long ago. We found the following benefits of Vaccinate WA over the previous programs that we were using and that were most useful within our clinics. And these has helped with incorporating Vaccinate WA successfully into the school-based program. So some of the pros: no missed notes in the bottom of the school bags. Parents are able to consent without relying on the students to bring home paper forms. No more scrunch notes in the bottom bags. There's flexible consent options for parents. Late changes in consents can be seen at points of vaccination. So if the parent decides that tomorrow the kid's got some important ballet concert, they can change it and it can be seen really easily. It's One of my favourites is it's easy to check the student's air record prior to the clinic and at the point of vaccination, especially prior to catch-up school visits. And as a coordinator, I can systematically check a dozen records at a time, and it only takes me a few minutes. The ability for admins and coordinators to pull and save reports. My favourites are the immunisations performed today, and that really helps with an accurate count of vaccinations. And also visible records of changes to accounts. Staff are able to access where changes have made and who has made them. So my experience with Vaccinate WA is that it's so much better and more user-friendly than other programs we've used for school-based, especially things like CHIS, which we use for WACS. Now, I do acknowledge that Vaccinate WA has its nuisances, and I'm sure these will be smoothed out as feedback's taken on board and updates are rolled out. In fact, we had one on Friday, which has already had a lot of good improvements. I believe there's still a place for paper forms in the school-based program, and a smoother integration of electronic and paper form consents needs to be developed. Moving forward with the Southwest program next year, we still have many challenges to overcome, like the persistent vaccine hesitancy, especially in certain areas of our communities. And a focus for our teams in 2024 is improving the communication with the schools and how the schools communicate the information to the parents. We feel this is a vital step in the uptake of online consents. We've got a lot of catch-up work to do from the last couple of years, and we're looking at flexible options for families to access missed vaccinations. One of these examples is the expansion of the Bunbury Immunisation Clinic, which offers school-based catch-up 6 days a week and after-school hours, including our Saturday clinics. And that's a walk-in service along with other NIC vaccinations. We're looking forward to the Vaccinate WA updates that are coming and the improvements that'll come along with it for the program going forward next year. Thank you.
Are there any questions on Teams? No? Okay. Thank you, Sam.